So I think there's there's several major improvements that we need to perform in terms of biomarker testing in the UK environment. I think the number one is actually just making sure that everyone is now getting tested for the tests that are even on the test directory or that lead to treatment options that are available in the NHS. And that's not happening at the moment. The drive behind the setup of the Genomic Laboratory Hubs was that there shouldn't be any variation geographically, at least in England, in terms of what patients are accessing. And I think we all accept that this is a work in progress. We are getting better, but ensuring that all patients get a panel of testing for the appropriate lung cancer genes, at least for non-squamous lung cancer. And you can argue about what that panel should be, but the bare minimum needs to be those tests that are on the test directory. And there's a couple of others that can lead to treatments that are available either through early access to medicine schemes or for drugs that are undergoing nice appraisal and where we want to be identifying patients at the moment. So I think that's probably one of the number one priorities. And the second one is the testing timelines. And this all goes into this in that whilst we're redoing pathways and looking potentially at more complex testing, what we need to be sure of is that has limited impact on the timeliness of the results, because, these patients are often unwell. We need their results quickly, to guide their treatment. So there's some things that the laboratories can do around that. And, the Genomic Laboratory Hubs are looking at this, to try and squeeze the analysis timelines down. And actually, as we get to that point I was discussing earlier, where more and more patients are having the appropriate testing, actually the timelines will be coming down, because some of the problems is the need to batch samples. So if you're waiting for a sample to come in to run your plate, that can take longer if we're not getting the sufficient numbers coming through. But I think there'll be other things that we probably will need to look at in terms of the laboratory side, in terms of things like 7-day working to try and speed that up. I think what a lot of people don't realize, though, is that there's a lot of delays at the moment in the pre-laboratory stage or the pre-genetic testing stage. So getting the sample, out of the laboratory to the Genomic Laboratory Hub with the appropriate information, or even ordering the test, at time of biopsy, making sure it's truly reflex. And then just importantly, at the other side, when it comes off the sequencer, making sure that it's analyzed, interpreted, the report is generated quickly with an appropriate interpretation, and then passed back to the oncologist, so integrated into the patient's pathology report, but to the oncologist quickly so that they can act on it, or other members of the MDT. It doesn't just need to be an oncologist. And I think at the moment we're seeing lots of delays on either side as well as we rejig these pathways that we need to reduce to try and make sure that we can meet the timelines that are set out in the optimal lung cancer pathway for biomarker testing.